With skin cancer, early detection and early treatment is very important. The earlier you detect something and the earlier you can treat it, particularly with Mohs surgery, the less the tumor can grow and cause damage in that area.
I had a growth on my nose and it grew very quickly and it disturbed me, and I tried all the ordinary methods and nothing worked. So I went to a dermatologist and they took a biopsy, and they didn't indicate one way or the other what they thought it might be. And when you go home and you wait for the results, it's 50-50. They're going to say you have cancer, or they're going to say you don't. Even when they call and say you have cancer, it's always a shock, because you just don't think it's going to be you.
Lynn had a squamous cell carcinoma on the left side of her nose, and that's a pretty prominent area for people. When you look at someone, one of the first things you look at is their eyes, their nose, and their lips. And so it's pretty distressing to people to have a large skin cancer on their nose. Luckily, she was referred here, and we were able to treat her with Mohs surgery.
I felt Dr. Posten had a very professional way. He simply seemed to exude the fact that he could handle this problem for me and that he knew how to do it, and I felt comforted.
Her tumor had some deep roots that were more extensive than what we saw on the surface. So we had to go back and take out her tumor in 3 stages. When we finished the procedure, she was left with a hole in that area on the side of her nose. To repair that, we decided to do a full thickness skin graft, where we took skin from her shoulder and we stitched it onto her nose. We then allowed that to heal, and with time and blended in, I think when you look at it today, it's hard to tell where she had surgery done.
My friends are amazed at how wonderful my nose looks. They insist that you cannot tell, and they think Dr. Posten did a wonderful job. If friends can't tell, it's invisible to anyone else. I think Dr. Posten did a terrific job.